Prostate cancer is one of the main health concerns for men. In fact, it is estimated that 1 in 8 men will face this disease at some point in their lives, making it the second deadliest cancer among men. What is most alarming about this condition is its silent nature. Symptoms are often minimal or practically non-existent in the early stages, which causes many men to avoid seeking medical help until the disease is already advanced. This delay can make treatment options more limited and significantly decrease the chances of a cure. However, there is something that gives us hope. Prostate cancer is one of the few types of cancer where detecting symptoms early can make the difference between life and death. If identified in time, 90% of men who seek medical attention survive this disease. The prostate is a small gland, about the size of a walnut, located beneath the bladder, and it has the important function of producing part of the semen. However, when some of the cells in this gland begin to divide uncontrollably, a tumor forms. It is important not to confuse this with benign prostatic hyperplasia, BPH, which is a non-cancerous enlargement of the gland that is common with age and generally does not present serious risks. Despite medical advances, science has not yet definitively identified the exact causes that lead prostate cells to become cancerous. However, certain risk factors have been identified, such as advanced age, excessive consumption of processed foods, obesity, lack of physical activity, family history of prostate cancer, and exposure to toxic chemicals like tobacco smoke or certain industrial products. In the early stages of prostate cancer, many men do not experience any symptoms because the tumor grows slowly and usually does not cause discomfort until it reaches a considerable size or spreads to other parts of the body. Therefore, it is crucial to be aware of the signs that could indicate the presence of the disease. Although not all men will experience all of the symptoms, if any of them appear, it is essential to see a doctor as soon as possible for a detailed evaluation. Before we begin, tell us in the comments how old you are and from which city you are watching us. Your participation is important and helps us create more useful content for you. Don't forget to like and subscribe to receive more health and wellness tips that can make a big difference in your life and the lives of your loved ones. Let's get started. Frequent or difficult urination. An increase in the frequency of urination, particularly at night, is one of the most common symptoms associated with prostate cancer, but it is also linked to other conditions, such as benign prostatic hyperplasia, BPH. However, when these symptoms are accompanied by pain, burning, or difficulty urinating, it is important not to ignore them. Polyuria, which is the need to urinate more often during the day, and nocturia, which involves waking up multiple times during the night to urinate, are common signs in those with prostatic enlargement, whether benign or malignant. In the case of prostate cancer, the tumor can grow in such a way that it presses against the urethra, the duct through which urine flows, obstructing the passage of urine. This can cause a delay or difficulty when starting to urinate. In some cases, men also feel like they cannot fully empty their bladder, resulting in a constant feeling of fullness. If this condition persists and is accompanied by pain when urinating or weak urine flow, it is important to consult a doctor, as it could be a sign of prostate cancer or an obstruction that requires treatment. Lower back pain. Lower back pain is one of the most perplexing and concerning symptoms when prostate cancer is suspected. This pain is not something that simply disappears with rest or over-the-counter painkillers. On the contrary, it tends to persist, worsen over time, and not improve with rest. In the advanced stages of prostate cancer, cancerous cells may spread from the prostate to other organs, especially to the bones. Bone metastasis is common in advanced prostate cancer, and the spine is one of the most affected areas. The lower back pain is generally experienced as deep, constant pain that is not relieved by conventional painkillers and may worsen at night or when the person is lying down. Additionally, if the tumor presses on the nerve roots emerging from the spine, sensations of stiffness or even difficulty moving the lower body may occur. In some cases, the pain may radiate to the hips, buttocks, or legs. If the lower back pain is intense, persistent, and not associated with a recent injury or physical exertion, it is essential to consult a specialist to determine the cause and, if necessary, undergo diagnostic tests. Weakness or numbness in the legs or feet. When prostate cancer spreads to the spine, it can compress the spinal cord or the nerves emerging from it. This phenomenon can not only cause intense pain but also affect motor control and sensation in the legs. Numbness, tingling, and weakness in the legs are symptoms that occur when the nerves responsible for controlling movement in the lower limbs are compromised by the tumor. This can make walking difficult, cause a heavy feeling in the legs, loss of balance, or even an inability to effectively move the lower limbs. Tingling or the sensation of pins and needles is a sign of nerve damage, and if not treated promptly, nerve compression can lead to partial or complete paralysis of the legs. In some cases, this can make daily activities such as walking, climbing stairs, or even standing for long periods challenging. It is crucial that if any of these symptoms occur, medical assistance is sought as soon as possible to prevent permanent nerve damage and to begin appropriate treatment to prevent disease progression. Blood in the urine or semen. The presence of blood in the urine, known as hematuria, or in the semen, referred to as hemospermia, is an alarming symptom that should never be ignored. Hematuria can present with red, pink, or brown-colored urine and is often visible to the naked eye, although it can also be detected through urine analysis. While hematuria can be caused by various conditions like urinary tract infections, kidney stones, or even trauma, the presence of blood in the urine can also indicate a more serious condition, such as a tumor in the urinary tract or the prostate. In some cases, hematuria may not be visible but can be detected in routine urine tests. On the other hand, hemospermia occurs when there is blood in the semen, which can result in semen being expelled with a pink or reddish color. Although hemospermia can be caused by benign prostate infections or inflammations, it can also be a sign that prostate cancer is present, especially if accompanied by other symptoms such as pain or discomfort during ejaculation. In any case, both hematuria and hemospermia are symptoms that should be evaluated by a doctor to determine their origin and, if necessary, perform further tests such as an ultrasound or biopsy to rule out or confirm the presence of a tumor in the prostate or other organs. Remember, while these symptoms may be concerning, they do not necessarily indicate cancer. However, if you experience any of these signs, the most important thing is to consult a doctor for an accurate diagnosis. Early detection can save lives and significantly increase the chances of successful treatment. Do not underestimate your health. Being informed and acting quickly can make a significant difference. And that's all for today's video. If you found this content helpful, share it with your friends and family. Maybe someone close to you also needs this information. And of course, don't forget to like and subscribe to the channel to keep receiving valuable information that can transform your day-to-day life. See you in the next video.